doctor, doctor. I'm screaming doctor, doctor.
All right, here we are on a Wednesday morning. Time for us to have our weekly doctor visit with Dr. Stan Anderson. Good morning, Dr. Stan.
Hey, Pam, great to talk to you.
All right, so I survived without any kind of injuries from 4th of July. How about you? I was good.
Yeah, it was good. Yeah, there were fireworks that were going off all around us, and so we had a great time just experiencing what other people were doing.
Yeah.
Yeah, we didn't make a lot of noise ourselves, but it was fun to see what other people were doing.
Oh, good to go. That's good. So yesterday, we heard the really sad news about Bernie Kosar, him coming out and talking about being diagnosed with Parkinson's, and also that he's been put on a liver transplant list. Talk a little bit about that, Dr. Stan. That's got to be really rough.
So first off, the two are not necessarily related in that people with liver problems don't necessarily develop Parkinson's disease, and Parkinson's disease people don't necessarily develop liver problems. So there are two separate issues. Parkinson's disease, generally when you think about it, you think about the four cardinal signs, which is a tremor. The tremor that most people get is what's called a resting tremor. And it's almost oftentimes first described as pill rolling. So if you take your index finger and you put it on your thumb and you kind of roll your index finger over your thumb, that's the kind of resting tremor that most people get. And it's usually in the small muscles to begin with, and then usually it ends up advancing. Now, not everyone gets it. Only about 75% of people with Parkinson's disease actually get a tremor, but it is one of the hallmark signs. The other is what's called bradykinesia. What it simply means, trouble with motor planning, starting to do almost any movement. So it's a harder time getting up, getting out. The big thing that we see is muscles of the face are oftentimes affected. So people look like they don't really make many facial movements with it. So masked faces is one of the critical things that we see. And then stiffness or rigidity. And so it's increased resistance to moving anything. So if you're sitting there and somebody else moves your arm for you, there's a lot of almost cogwheeling or the feeling like when you move the arm, it ends up being harder to move. So rigidity, stiffness, and we're not sure if that's part and parcel of it or if it's a reaction. All we know is that's one of the big things. And then postural instability. So typical later on, it leads to impaired balance, a lot of falls, impairment in memory, impairment in cognition. Dementia is one of the other things that oftentimes happens. So think of it as people age, they end up stooping over, they end up having a more halting gait, they end up being just a lot more frail, and the more common way in which people end up dying from this is every muscle becomes involved, so they have a hard time swallowing, and so they oftentimes will end up developing pneumonia. So Parkinson's disease normally doesn't kill someone, but what it does is it affects all of the muscles because it's nerve degeneration centrally, and it affects their functioning. So they get slurred speech, their voice becomes more quiet, their handwriting becomes smaller. They don't sense as well. So there's an impaired sense of smell, there's a disturbed vision, and they get weird nerve irritation, so pain, some tingling, and they just don't see things as easily. And they end up oftentimes getting something called a peripheral neuropathy. And then it oftentimes causes them to have blood pressure problems. They end up having stomach issues, so they end up having constipation, harder time with moving the bowel movements. So in one sense, you can kind of think of this as, well, you know, as we get older, many of these symptoms seem to come on also. So could it be that Parkinson's disease is basically a more rapid form of aging? That's what many of my patients with Parkinson's disease end up saying, that, yeah, everything just, it seems like I'm aging a lot faster, I'm slower, I don't have as good a control. And oftentimes what the caretakers say, what their partners say is they're just a lot more angry. They at the drop of a hat, they're more likely to become a lot more anxious or angry or upset. And oftentimes they end up having a blank stare on their face when you're talking to them. They don't end up looking quite as involved with the conversation as they otherwise would be. So those are some of the symptoms that oftentimes, there's actually quite a bit more. Brain malfunction, you don't sleep as well, you end up having skin issues. So it's pretty much a comprehensive, it affects almost every organ system, and it's something which we don't know the specific things that lead to it. So we can't say we know why people get this. What we assume is that it's due to some interaction of genetic, environmental factors. Obviously, brain injury can do it. So people that have had, for instance, an aneurysm, and they've ended up having to have the aneurysm repaired, or if they've had any kind of damage in the brain, their likelihood of developing Parkinson's disease is significantly increased. Interestingly, caffeine, nicotine, some potential neuroprotective features. So there is a possibility that if you drink a lot of coffee, and I'm sitting here at my desk with my cup of Java this morning, that there might be some neuroprotective effects from drinking coffee. So my morning routine of raising a cup of Joe and listening to you and having a cup of Joe while I'm listening to you, I look at that as my way of preventing Parkinson's disease.
There you go. There you go. And one quick question before I have to let you go. Does it progress more slowly for some people rather than others?
Yeah, there is no one-size-fits-all. It can go very slowly, but it always progresses. The problem is the medicines that we use, they work better at the get-go, but after you've been on these medicines, Sinemet is the usual name that we use, that's carbidopa, levodopa, they almost always stop working. So you have to increase the dose, and before you know it, you're on the max doses, and it's not having any effect at all. So the problem is, as of 2024, there is no good cure. There is no treatment that is not going to prevent the progression from eventually coming.
All right. A lot of great information, Dr. Stan. We appreciate it, sir, and we will talk to you next Wednesday.
I look forward to it. Our prayers go out to Bernie Kosar.
Amen.
1480 WHBC has always been there for you.